Educating, informing, serving. Fact TV, keeping government honest.
All right, let's call the meeting to order, please, at 5:07. 5:07.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, under God, indivisible, with liberty and justice for all.
We have made the suggestion that if we're speaking, to take off our masks, so it will help you with hearing, and also we feel that that's fairly safe. Everybody at our table has been vaccinated, and so if you would want to do that, you're welcome. We'll ask that if anyone wants to speak, if they will come up near where Ricky is to do the speaking, and so that's up to you. All right. Adjustments to the agenda. We had a parent request that I got on Monday to attend PF Middle School, and so I'd like to put that as 8B.
Jason, do you see Jason Benson on that?
Is our other board member there? We need to know who's here.
That's what I was asking.
Okay, thank you. Okay, are there any other adjustments? Okay. If not, we'll move on to communications and public comment. Before I ask you to come up and speak, who is here to speak? 1, 2, 3, 4. And can you see in Zoom?
Ask them to raise their hand.
Yeah, if you raise your hands on there, put your hand on Zoom so they'll know.
No hand.
Okay, so just 4, okay. I don't, as long as you don't make it too long, reason to really limit you. If you start going over 4 or 5 minutes, I may ask you to wrap it up. Okay, so who would like to go first?
Good evening, I'm Jennifer. I'm the school nurse at Central Elementary School, and I first just wanted to speak a little bit to advocating, I guess, for the.
I'm having a lot of trouble understanding what you're saying.
Feel free to take your mask off if you would like,
Okay.
while you're speaking.
So I just wanted to advocate for the elementary school age kids. At this point, I watched a little bit of most of the school board meeting that you guys had here a couple of weeks ago, and there seemed to be a lot of discussion about, meeting the 80%, the vaccination rates and so forth. But my biggest concern as an elementary school nurse is 10 days or not, our elementary population will still not be eligible for vaccination at that point. And I don't feel that 10 days is really adequate time frame as far as to be able to give us any kind of data. It's not giving parents at least, or family members, that choice to vaccinate by that time. And in addition, it's not following the state guidelines really that have been put forth. I know that last year we were asked to consult with both Dr. Keith Loud from the head pediatrician at Dartmouth and with Dr. Hall, our local pediatrician here. And although we have consulted with Dr. Hall, we didn't get the chance to talk with Dr. Loud. However, he has put out in a statement last week that he is in alignment for following the state guidelines of both Vermont and New Hampshire. So I want that to be noted because we went back last year and had to consult with him to get the week remotes after vacations. I did, with the nurses, reach out to Dr. Hall, and he may be here. He was planning to attend. I don't know if he's here or not. But while you're looking, I just want to make it known that at the elementary level, we still have medically fragile kids. We have kids that obviously cannot wear a mask, and I feel it's important that we're trying to protect that population until those kids and families have the chance to vaccinate. I do have a letter from Dr. Hall if he's not here, and it looks like he's not, so I will speak for him. Dear Rockingham School Board, as the local pediatrician who works closely with school nurses in our district, I'm delighted that this community is fortunate to have an excellent school nursing staff with deep experience and investment in our children. They have raised their children here and they look out for our school children as their own. I'm very proud of their hard work and thoughtfulness in bringing our students through this past 1.5 years of the COVID pandemic. There was a hope that a large COVID-19 vaccine trial involving 7,000 US and Canadian children would be near completion in August, and that by September 2021, we'd be administering COVID-19 vaccinations to children under 12 years of age. This has been delayed by 2 to 3 months to meet FDA requirements to ensure proper dosing, safety, and efficiency. The current hope is that vaccination will be available to our younger children in late fall 2021 or early 2022. While Vermont has been a leader in vaccination, we are now experiencing the fourth wave of infection brought on by the Delta variant of SARS-CoV-2. Current testing shows positive tests at similar rate to those we experienced in February, and hospitalizations have been doubling every 2 weeks since the beginning of July. More children are hospitalized currently with COVID-19 in the US than at any other time since the start of the pandemic. The vast majority of hospitalizations are unvaccinated persons, and many are younger and healthier than we have seen earlier in the pandemic. The American Academy of Pediatrics is recommending that children return to 5 days in person schooling this fall, and that 1, all eligible individuals should receive the COVID-19 vaccine, and 2, all students older than 2 years and all school staff should wear face masks at school unless medical or developmental conditions prohibit use. I implore you to follow the American Academy of Pediatric guidelines in line with the Centers for Disease Control and our Governor Phil Scott's recommendations that at least until 80% of our eligible students receive COVID-19 vaccination. We protect our students, staff, their families, and our community by this simple measure of masking in school. It is inconvenient, but it is not deadly. The health of our children and their families is paramount and is part of your responsibility as a governing board of our local schools. Thank you for your consideration and thoughtful response. Dr. Elliott Hall. So I just ask that you be really thoughtful when you're making your decision, because we are different than the middle school and the high school. We are kind of a separate entity, and a little bit, I think we're kind of periphery and don't always get thought about. And now this year Central has preschool. So I'm sorry, but we have babies. Those guys are babies. And I don't have a kid that age anymore, but I just think it's really important to be thoughtful. It makes me emotional to think about it. So thank you.
Thank you.
My name is Rebecca Stockwell. I am one of the nurses. I float to all the schools. So I wanted to start out by first acknowledging that there are board members who are thoughtful and listen and believe in science and follow the advice of the state, and I want to thank those people. So as I understand it, the board would like to have schools open 100%, as this is the best way for students to get instruction. Masks help decrease not only the spread of COVID, but things like the common cold. We saw far fewer students with colds last year. If we only talk about keeping kids in school, then masks make the most sense. Any students with cold symptoms are going to have to stay home, which means they're going to miss out on that instructional time that we so want them to have. So the goal of having students learn in person, but making masks optional, are in direct opposition with each other. Next, I have a question for the board members who oppose a mask mandate. If there is no mask mandate and there is an outbreak or a cluster, and someone dies or is disabled from getting COVID, how are you going to sleep at night? And what are you going to do when the school is sued because you disregarded the recommendations from the state? And if you're willing to just roll the dice and hope that no one gets sick or dies, then I want you to be very clear during this meeting that you're willing to put lives at risk. I also learned that the American Civil Liberties Union considers unmasked schools to be a disability rights issue. The issue being that those students with certain disabilities, such as immunocompromised, will essentially be excluded from school, and we cannot exclude students with disabilities. The Supreme Court has also made it quite clear that personal choice does not have a priority over public health or a parent's right to choose if their student wears a mask. In fact, the ban on masks in Florida schools that the governor made by trying to use Florida's law regarding parents' right to choose the medical care their children get was struck down for the reason of public safety. I fully understand the Vermont governor said the mask mandates are in the hands of the school boards. However, in our neighboring district of Green Mountain, the school board delegated that decision to the superintendent instead of micromanaging. Perhaps this board could learn to trust the staff that I am 100% sure care about the students in these buildings. One of the principals reached out to Secretary Dan French, and the quote was, "Board should follow our guidance on 80% vaccination rate before removing masks." And I don't believe any of the schools in this district are going to reach that 80% threshold because of the populations that we have. Requesting to have students wear a mask is not a big ask right now. The state gave recommendations. Choosing not to follow them is negligent. Asking the staff for their opinion after you have already tried to make masks optional shows a blatant disregard for their input. Thank you.
Okay. If you could keep it short, please, because we've been in comments a long time.
You have one hand.
So I am the school nurse at the Bellows Falls Middle School. And my previous job, I worked for the Vermont Department of Health for 2 years. A lot of that was during the pandemic. And my primary role during the pandemic was outbreak prevention response, working directly with the schools as well as other communities such as churches, businesses, you name it. I worked with a dentist's office. And what I saw when there was a case in one of those facilities, those who wore masks and followed mitigation strategies did not have outbreaks, did not have spread. Those who did not had outbreaks. Many of them had deaths. I do not want to see that in our school communities. I feel I am responsible for these kids' health and safety as their nurse, and I ask you please to follow the recommendations of the Agency of Education, the National School Board Association, the Vermont Department of Health. I could go on, but every one of them recommends wearing masks.
So that from here. Okay, we seem to have one additional, so more rounds.
Hi, I am a teacher at Central Elementary School, 4th grade, and I am also a parent of 2 girls at Central Elementary School, 2nd grade and kindergarten. And I feel incredibly strongly that the children should remain masked and the adults should remain masked for the time being. Their safety is our #1 priority, and it has been shown that this is the best way to keep the children and the staff and the community safe. And I strongly encourage you to keep the children safe. Thank you.
Thank you. Is that it for? Thank you all of you for your comments. I would like to, with the board's agreement, skip the review and approve the board minutes since this is a special meeting and we really have limited content for tonight. Is there any objection? Would you check with Jason, because he's not?
Still there. Mr. Benson, are you still there?
I'm here.
Are you okay with skipping the board minutes till next time? For
Yeah, we
review?
can table those.
All right, thank you. Any report, would you also be sure to turn off the chat, because our council recommended that we not have that. Okay, reports, are there any reports separate from the ones that we've got on here? I don't think so, okay. Unfinished business. We wanted to look at the questionnaire. The reason for doing the questionnaire was because we did have a motion for masking, and which does follow the state guidelines. It follows the AOE specifically. In fact, it almost is a little bit more narrow. If we applied only the part where we added sitting, they can remove their mask, that would be more limited, but we did say following the guidelines, and which according to the guidelines also say masks when required may be removed when needed for instructional or operational purposes. That has not been put out to you in your things, teachers, but it is in the guidelines that came from Dan French and the ones that we are supposed to be following, that we passed in our district, to follow the guidelines, because that's what had been recommended. So ours does limit, because from one standpoint, because it does say when they're seated for instructional or operational purposes. And granted, our children are young, so we would expect that teachers would be able to do that. I do know that, in talking with my principals, that, if the child needs a mass break in some of the schools, definitely they're giving those. The child can ask for one, or the teacher can provide one. So they are looking out for all of our children. I would like to look at those results, because I was seeing in the results, and I wrote them out, pretty well equal yes and no from parents on masking, and very much more so for teachers wanting children masked, much more masked for the children than for the adults, but it still is more than 50% of the ones that we've got, although I would love to have had 100% feedback from that. I'll let our principals address it a little more specifically in a minute. Our staff, I was really thrilled to see that we have 20, I should have totaled it. 69 of our staff said that they have been vaccinated, which I felt there would be a really positive amount of our staff, which is one reason we were asking that. It does give you the chance for only eligible are at the middle school. And there are only 37 that were reported, which is only 25.17% of eligible. So that gives our nurses, and some of our nurses are here, it gives our nurses the chance to push for that vaccination so as to cut down the risk to those other children. Let me start with Laura. Would you like to report out on the questionnaire at Saxons River?
I certainly can. Hello, everyone. Ricky, are you projecting data?
I'm not, but I can be.
Yeah, I think a visual would be helpful to the people in attendance. And you did such a nice job compiling the data, so. And the graphs really speak for themselves as far as the compilation of data. Let me know when you're ready, Ricky.
Thinking about it.
Okay.
Yeah, share my screen now so that way you know what I'm sharing. And jump through some hoops to share my screen so you can have it share. You see my screen, Laura?
I can, yes.
So many windows now.
Um, So as I said, the data clearly speaks for itself as when it's represented this way. We had 39 respondents. Families selected which school their child or children attended. That was one of the first things. And then the data was compiled thereafter. So you can see the percentages listed there for Saxton's River. As Priscilla shared, about 50-50, 51% yes, and 48.7 no. And then staff is the next graph down. So a larger percentage of staff, 56% of staff would like, 56% of our families would like staff to wear masks. And then a question was asked about the type of face mask required, cloth, clear, or clear face shields. And you can see the data represented there, and clearly cloth masks were preferable. Can you scroll down, Ricky?
Want me to scroll down? Yeah, that's as far as it goes. Want me to go on the staff?
Yeah, I can't see the tabs on the side, and there we go. So a similar, oops,
Okay.
there we go. A similar survey was asked of staff. And there we go. Yep, perfect. Excellent. We had 13 respondents, and again, the first graph shows that I don't have my glasses on, but it looks like 76.9% were in favor of students being required to wear masks, and 61.5 in favor of staff wearing their masks. And then that, again, the type of mask, the preference for masks, and overwhelmingly, once again, cloth masks were preferred. Do you want to click the next?
Which slide are you looking for?
So this slide shows vaccination rates. This is not what I was. Let's see. So this is just showing the respondents. Ricky, where's the one that has the, oh, you did just a combination? No, this is the middle school.
The one on the right, Laura, has Rockingham separated by schools.
Yeah, but this is just the number of respondents. So 13 out of 13, I guess, because there isn't a percentage here. I think the next tab down has the actual graph.
I'm not sure of the graph. I mean, there's one that I'm not sure there's a graph of the vaccination, Laura.
Oh, okay. Maybe that was on something else I saw. But so as you can see, you know, there is a strong favorability for the wearing of cloth masks for students and staff to be vaccinated by both staff and then split with our families. Let's see, what else? I think that's it. So I'll turn it over to Carrie or to Sue.
Ricky, does that vaccinated one possibly, does that show the ones that are vaccinated? That
Yes,
don't
it's just yeses, I believe.
Yes, okay. Okay, so, Laura, before we turn it over, SRES, how many do you have on staff? We have 13 that's saying it's vaccinated. How many?
Well, the email had gone out to 26 folks, so only half of our staff responded.
But you were telling me you think the vaccination rate's much higher.
Oh, I do believe it is. I mean, if you, I do believe that it is. I do not have that data though. This was a voluntary survey.
We could get that for our next meeting.
I can certainly ask. People always have the right to not participate.
Actually, as their employers, we're being told that we can ask, and so you can at least ask.
Oh yes, I can ask, but they don't have to. They don't have to answer, is my understanding.
Not until if we could do something like the Unified District and end up requiring vaccinations or testing, which may happen soon, or the governor decides that he's going to require it. So I don't know at this point. Our council told us, yes, we could ask. Jason, did you have a question for her?
Well, it's just the way, Ms. Hazard, I could be wrong, but one of the slides I think showed it was the staff school only. Ricky, can you pull that one up, please?
Sure. Yeah.
No, this one it says Rockingham school staff masking questionnaire. There's Bells Falls at 34. Staff, the last one, staff school only. So can somebody help me out with this? Because it says 34 here, so I'm assuming that they asked 34 staff here.
Oh, that one is, yeah, that one's the middle school, and then Central. It wasn't the number of asked, it was the number of respondents.
Okay, so 34 responded, but of that, if you look at the vaccination rate on student vaccine rates, that slide, does that mean that 28 of the 34 said yes, they have the vaccination, right? Am I reading that right? And
He's one tab up.
so one,
He's on.
so right there. So if you look at, go back to the last one, and I'm just trying to understand it. I'm not questioning, I'm just trying to understand it. So please don't beat me up.
Yeah, I can only speak for Saxons River, but so 13 respondents, and then 13 of the 13 have been vaccinated.
And at Central, they asked 30, but 28 weren't. But then, and I had a question for Kat, is she still here?
No, she stepped up.
Okay, so I didn't know of the, Ricky, if you click back on that student vaccine rates. So of that, and I know this middle school, but it says total students enrolled 225, eligible population 147. So that means because the 5th grade is also here, they're not eligible, right?
Correct.
I'm assuming.
Mm-hmm.
And then the vaccination population 37. So of that, we're at 25%. So that's not from the state. That's just our questionnaire, right?
That's just our
Okay.
questionnaire.
Mm-hmm.
All right. Thank you. I'm clear. Thank you.
Just to provide some information.
Okay. I was just again, just trying to get all the data to make a good decision for everybody.
Everybody all set for Laura? Thank you, Laura. Carrie, just turning it over to you, so why don't you go ahead?
So similarly to what Laura was saying, so if you combine, just maybe want to go to student and either one. Do you want to combine? Okay, so that's fine. So with the respondents that we had from students and from families, we've heard from 84 individuals, and 57.1% had said yes, everybody should be masked, with 42.9% saying no. Should staff be required to wear masks? And it was at 64.3%, excuse me, and 35 saying yes, 35.7% saying no. And again, that's staff and student families. And then preferred mask, if they had to wear a mask, it was 87% that said they prefer the cloth mask. And then it was small numbers that are, I don't know actually 7%, or excuse me, 6.5% said clear masks, and, 6.5% that said face shields. So overwhelmingly, they had said that they would prefer to have masks. I know for the staff, when you break it down as well, had a larger number that they preferred to have the masks at school. So it was about 87% for staff that students should be required to wear masks. And then with that, so staff should be required, 90% said yes, and then again, it was the cloth mask. So that was the overwhelming response that we've had from all of our participants from this. So.
Do you need me to do anything?
No, I think that's it for now. That's pretty much about it.
I know when we talked, you were feeling like almost all your staff had been vaccinated.
Yes.
So,
Yes.
so which we were hoping that, eventually we can have that kind of pointed out and maybe the percentages so that eventually that, I'm hoping to make our families feel more comfortable with that kind of thing.
Sure.
Does anyone have questions for Carrie? Okay. You're off the hook.
Susan. Thank you. Ricky, if you could go, yes, that's fine, thank you. So we had 106 respondents to the student masking questionnaire. The question about should students be required to wear masks, 53.8% said yes, 46.2% said no. Should staff be required, 54.7% yes, 45.3% no, and then an overwhelming margin at 87.7% requested cloth masks or suggested cloth masks. If we go down to, if we go to the student vaccination rate, Ricky. Okay, so we have a total enrollment of 225 students. The eligible population to receive a vaccination is 147 students. That's because we have 5th grade students here, 10 and 11 years old. So reported vaccinated population of that 147 is 37 students. So the percentage of the school that has been vaccinated, this is our student population, is 16.44%, but percentage of eligible population vaccinated is 25.17%. Then if we go to the staff survey, the staff went out to, the survey went out to all staff. The 34 respondents represents a little over 50% of the staff. And of the 34 respondents, should students be required to wear masks, 82.4% said yes. Should staff be required to wear a mask, 64.7% said yes. And cloth masks at 91.2%. I'd be happy to answer any questions as best I can, given the data.
Yeah, it helps some, but we realize that it does not include all of our parents, but it's a really good, nice thing to see where they're at and for them to know that we do care enough to at least ask. Although we've already done our motion for the masking, which we're going to cover under the protocols. So if there are no other questions for Susan, I kind of cut you off, I didn't mean to.
No, that's fine, I was done.
Any questions at all? Any questions for Jason? Okay. Protocols for opening schools. Basically, I think our staff received a training on the things that they could do, and it's probably much more specific than we have, but I'm going to ask Megan to read the mass things that Dan French put out that our motion was based on, so that's clear and part of the record.
You didn't warn me about this,
I didn't.
I'm just bringing this on. All right, masks. To allow school districts time to calculate the percentage of currently eligible students who have received 2 doses of a 2-dose vaccine, Schools should require universal masking for all students and staff when indoors for the first 10 instructional days of the school year. Currently, all Vermonters age 12 and older are eligible to be vaccinated. Following the first 10 instructional days of the school year, masks should no longer be required for all those eligible for vaccination when the vaccination rate, 2 doses of a 2-dose vaccine, among students is equal to or greater than 80% of the school's currently eligible population. Masks should be required indoors for students younger than 12 who are not eligible to be vaccinated at this time. Masks, when required, may be removed when needed for instructional or operational purposes. Masks are currently required for all passengers on buses per federal regulation, regardless of age or vaccination status. Masks should not be required outdoors. And finally, guidance will be updated when vaccine eligibility expands.
And our motion addressed that because it said the motion was to follow the state guidelines on masks for 10 days or shorter if the data collected supported reducing the time, which at this point it doesn't. So that's kind of a mute part of the motion in response to the questionnaire. So with the added stipulation that while students are sitting at their desks, the student mask may be removed since that is operational or instructional purposes, and motion to be reconsidered on September 20th. So basically that's directly in keeping with the state guidelines. So we wanted our parents to realize that. And so all students will be wearing masks for the first 10 days. And then, oh, and boy, would it make me so absolutely ecstatic if all of a sudden everything was gone and we were all in the country without, and then on the 20th we could say, oh, there's no more COVID here. We're probably not going to get that. I have to be reasonable. And so at that point, yes. Do I think we're going to get the 80%? Probably not at that point. But we do need to be encouraging all of our friends, all of our parents, anyone that can, that is eligible to get that. Our middle school is in kind of a difficult situation too, because their 6th graders will be turning 12, many of them, right through the year. So that's going to impact as well. So that's something we're going to, as a board, have to be really aware. We also realize as a board that our 2 elementary schools, K through 4, preschool through 4, are not going to have that vaccination right at starting school and be here for a while. They're saying it's been put off for a little bit, so we'll have to redo that. Are there any questions? Megan?
I just want to be clear that this guidance, basically, guidance will be updated when vaccine eligibility expands. So for our youngers, unless anything changes, is it convenient that the 10th day of instruction happens on September 20th? Did you plan that maybe?
We knew that when we
Are
did
we
it.
going to revisit? Do we have to go through this all over again for our younger population, or are we going to stick with the guidance?
Well, we'll make that decision on the 20th.
So this is a Band-Aid until the next one.
Yeah, and it'll be revisited through the year. I'm sure all of the boards are going to revisit it because as things change, it's going to have to be. It may end up being the entire year. We may not be able to do anything about it. But
I'm glad at least
we
the
might
10
be able
days
to also.
ends on September 20th.
Okay.
Okay.
Jason,
I just have a question for the nurses, if they can answer that question.
you can ask.
Is Kat or Rebecca are gone there? Can I ask you a question?
Dr. Hall's here too. Dr. Hall came in.
Rebecca, nice to meet you. Do you guys know when, have you guys heard through the grapevine when a vaccine will be eligible? Like, what's your gut say for kids?
So some additional requirements were put on Pfizer with their study in children starting from under
Would
12.
you mind standing, if you need to stand away from the group, so that you can take it off so it's clearer to us?
So the study of US and
I
Canadian,
can't, you're muffled. That's why I said if you stand away from the group, would you be comfortable taking your mask down
I
to
don't-
talk to us?
not really.
Not really, okay.
So the study of children under 12 by Pfizer was initiated in March, looking at 7,000 children. Some additional requirements were put on Pfizer to expand that study. So initially, we had hoped that we would have data in August or September, about now, to begin giving vaccines. And that just is not the case. It's been put back at least 2 or 3 months. Dr. Fauci says that we should be thinking late fall or early winter, just for the data to be presented to the FDA about that. And it usually takes at least 4 to 6 weeks after that before any recommendation about vaccination would happen. So I'm not anticipating that we're going to have the vaccine for kids 5 to 12 until probably December, maybe more realistically in January. And the kids between 6 months and 5 years, it's going to be well beyond that. So I'm anticipating some possibility of giving the vaccine to kids under 12 by the new year. That's really the best we can say now. If the data comes much sooner, it could be November and December. But I would anticipate a reasonable expectation that by January we can start to give the kids the vaccine.
Thank you.
Thank you. Dr. Long, would you send that information to us by email, because I found it difficult with it being muffled to follow. So if you could do that, I'd really appreciate that. Thank you. Is there anything else under that? Any other questions? Jason has his hand up, so please.
Well, I hate to be the one that runs the train off the tracks here, but just looking at the results from our surveys and everything else, I think it's pretty clear that we're not going to reach the 80%, possibly even this school year. So we really need to rethink the motion we had at our last meeting. And I would suggest, in my opinion, omitting the part about unmasking, because it's pretty clear that both our staff and our community that are willing to participate in the surveys, they are comfortable with the masking and they want the masking, and that's the thing about these surveys is we put it out there, and if you want your opinion to be heard, you need to take the initiative to respond to these surveys. And this is how a democracy works. And I see no reason for us to continue with our previous motion. We need to go by the state guidance. We really do. And
Okay.
listen to our nurses.
We need to do the motion the way it was because of the time frame on it. So at this point,
We don't have to.
yes,
We could do a new one.
So let's just
Says
go
you.
on to the next.
I just don't feel as though it's our position to be playing doctor and nurse. It's pretty clear that our staff has spoken very loudly and our community has spoken very loudly.
And we listened, and we will listen to them, and we will revisit it, like our motion said, on the 20th, just like it said. We will have I don't think there's any problem with that.
Okay.
Right now, half and half, we're listening to all of our parents. And
the only other problem I have with the motion is there is no
really in favor of it,
clear
Jason.
order.
Okay.
There's shoulds and not shalls. The shall is an enforcement. The should is just a suggestion. And we need to get out of this. We need to
Jason,
give our community the support they want and listen to them. So that's all. Thank you.
Yes, he is. Okay. Jason, the thing is that the teachers have the authority in their classrooms to use the masks the way they need to. And so that's the thing that our motion did. So we are in good stead with the masking, and this is a special meeting. So if we could move on, please, to the report of the tour of Rockingham schools. Megan, you did Jason, you were at the central one?
That's correct.
Okay, if you wanna.
I thought the You know, as usual, with all my kids, I went to Central School. You know, as usual, the teachers were there working late. You know, not because they had to, but because they wanted to. And you know, it's a good group, so we're pretty lucky. And I'm sure you know that.
I agree.
I thought the school was good, and you know, everyone's working hard, and it looks like it did, you know, 10 years ago. And I remember my son is a senior now. He started there in kindergarten. So. He's come back.
Okay, I toured Saxon's River. I was very impressed with the areas that teachers are setting up. Some of the, with the masking, which is an important thing, is that they can sit at the group times together and be able to look at each other and not have to be 6 feet apart this year, which is a very big plus. Laura told me that some good things about mask breaks that I was really absolutely thrilled with, because I realized her teachers are flexible and they can provide for their students and still keep them safe. So, which is the same thing that's in the masking by the state. They can be removed when needed. Ours, like you said, when sitting is a little more stringent, but that's probably a good thing with the way the COVID is going at this point. We toured all levels of the building and saw a lot of different classroom setups, a lot of different ways, as I did at Central School, where one classroom is set up where they are now sitting across from each other, and I was thrilled with that. Granted, if they have to take their masks off, they'll need to separate and do that, but that's a teacher option.
Could I just interject that that's also because of the number of sizes of students in each classroom is very varied. So some grades have more than others. That's why they're able to do a little different configurations.
Yeah, good point, Carrie, thank you. Totally, I had not seen the new kindergarten wing, so it was nice to see that. It was nice to see where the preschool is going to be and know that the guys are keeping them safe. Middle school, I really enjoyed the middle school. Having attended Central School and having attended the middle school, when I was in school, it was a pleasure to be able to see the changes and the differences and the way the buildings are set up. And I would, once COVID's over, I would tell every parent, if they haven't had a chance, please visit. Because it is a wonderful experience to see where your child is and to know that the teachers have gone to such levels to set up their classrooms and to do that. Okay, any questions? Any questions for our principals or for any of the board members that visited? And anyone else on the board? All right. Moving on to appointments and resignations, we have an appointment of a science teacher. Susan, would you like to speak to that?
Yes, Madam Chair. We had an opportunity to interview to fill an 8th grade science position most recently, and we were very fortunate to find an exceptional candidate, Kimberly Alderman, and we extended an invitation to join our staff as an 8th grade science teacher. Thankfully, she accepted, and I highly recommend to the board that she be hired, that her contract be approved for hire.
Okay. Are there any questions? Jason?
Does she happen to meet the graph that we're promised to have? Mr. Brett's on here, unfortunately. like as far as like years and masters and BA, like what, do you happen to know what step she's being hired at?
I don't offhand, Jason, I can get that information for you. I wasn't prepared to speak to that, but I can certainly get that information to you. She has an associate's degree, a bachelor's degree, and a master's degree, and is very highly qualified. So I'll get you those numbers, though.
Thank you.
You're welcome. Okay. Nicole was going to send it to me, but I did not get it, so I can't share that with you either. Okay. Are we comfortable with moving ahead with that, or does somebody want to make a motion? Or
Just to start, make the motion, let me phrase this, to accept the contract for Kimberly Alderman for the position of 8th grade science?
Yes.
8th grade science teacher at Bellows Falls Middle School.
Any discussion?
I'm in favor of it as long as she is within the guidelines to be consistent with all the other hires, because that wouldn't be fair to all the other hires if she was hired above or below.
I'm pretty sure that was checked. We can check on it and confirm that. So you're all right with calling the vote?
Do we need a second for it?
No. Yeah, you do. You do. Do you have a second? Okay, thank you, Jason. Okay. Jason, Megan, how do you vote?
Yes.
Jason Benson?
Yes.
Jason Terry?
Yes.
Okay, so Kimberly has been appointed as the new science teacher. We're on director's comments.
We skipped.
Oh, we skipped. I apologize. Yes, we skipped B because it wasn't printed. Sorry. Thank you for pointing that out. We had a parent request to attend Bellows Falls Middle School. Sierra, would you like to address that?
Would you like me to go front or?
Yeah, I really would.
Hello, my name is Sierra Patterson, and I am an employee here at Bellows Falls Middle School. I currently live in Westminster, Vermont. I am petitioning the board to allow my children, Gracie Patterson, grade 6, and Fabian Patterson, grade 5, to be allowed to attend Bellows Falls Middle School starting this year. Due to many things that are out of our control and where we live, my kids get on the bus around 6:50 to 6:55 in the morning. They then travel through Westminster, Gageville, and Bellows Falls to arrive at Westminster Center School around 7:55 a.m. We only live 2.6 miles from Westminster, so transportation, needless to say, can be challenging. The bus driver has been fantastic. I have no qualms about them or at Westminster. I just think that they spend a long amount of time on the bus to travel a short distance. I have to be to work at Bellows Falls Middle School at 7 a.m., so I cannot manage the short drop-off time that Westminster has between 7:45 and 8 a.m. If allowed, my children can either just drive in with me in the morning, or my olders can drop them off on their way into the high school. They can't drop the kids off at Westminster at the high school because of the short drop-off time. The only option we have is for them to drive the bus. My children also enjoy sports, and Westminster has not been able to provide as many opportunities. At Bellows Falls Middle School, they would be allowed to play soccer and or run cross country. Gracie will be attending Bellows Falls Middle School next year as a free choice student, and we also have discussed many times in Fabian's IEPs, also having him transition early.
Okay, did the board have any questions for her?
I just want to speak to this family. They play a big role in our school community. If there's ever something that needs to be done, I can't tell you how many times Sierra has jumped in to coach, to drive, to do anything. So, you know, very similar to with Kat Goodell, this is a family that really, really is a testament to the community, and her children are amazing. They'd be a great asset to the middle school. I just wanted to put my support out there for her.
Thank you, Megan.
Jason, do you have any comments? Jason Benson?
No, I'm good.
Jason Terry?
I just echo what Megan said. I know Sierra and solid person, solid family. I remember last year, I think they were short a bus driver to a basketball game.
And Susan, can you address whether we have space in our 5th and 6th grade?
Madam Chair, at this time, we do have space in both our 5th and 6th grade, so it would not be an encumbrance or a hindrance for these two students to join the Bellas Falls.
Thank you. Are we ready for a vote? Motion? I don't have a motion yet.
Would you like a motion?
I would like a motion, please.
To get a motion. So I would move to accept the request of Sierra Patterson to have her 5th grade and 6th grader attend Bellas Falls Middle School.
Okay, we have a first and second. Everybody ready, or do we need more discussion? I think we're fine. Megan, go ahead.
Yes.
Okay, Jason Benson?
Yes.
Jason Terry?
Yes.
Welcome to your children.
Thank you.
Thank you. Okay, and I'm sorry for skipping that. I had it written right there in front of me. Thank you. Okay, director's comments. Jason Benson, would you like to start?
Sure. I think everybody needs to stay the course and just pay attention. We're going to get through this, and it's just a temporary setback. And don't pick sides. Don't play political. It is what it is. It's something that's scary that nobody likes, and we'll get it through it. That's all.
Jason Terry?
I'd like to apologize to Susan. There was a meeting yesterday, and I wasn't part of the meeting. I wasn't there, but I watched it on TV, like a lot of people, and it was disturbing. So I'm not sure if you got to watch it, but I don't think that's how our community really acts. And we all want to do the right things. Thank you.
Hi. We're not going to make it through this year if we're not working together. And I think we're off to a good start. I think we are. It's so hard to listen to these meetings, not ours. Ours are wonderful. But it's going to get worse before it gets better, I think. And when I joined this board a year ago now, I sent my email because we had a meeting that was quite contentious last year where things happened. This isn't the same board. And I came on board in October, really just ready to dislike everybody here. I'm sorry, I was. But
we're glad we didn't.
I disagree with my fellow board members quite often, but I've learned to appreciate them because this is a really tough seat to sit in. It's not easy. And so I want to encourage more teamwork. We represent, last night there was a comment, and she was absolutely right, and I love her. She said, we represent the students and the staff, we do, but we also represent the community. So I try to keep that in mind when I'm like, what are they thinking? When I think of my fellow board members I disagree with, and I get it. And so I want us all to just keep that space where we can figure out, I disagree with that person, but I get it. And we're just gonna do our best. And we're also kind of a new board working with each other. So Priscilla and I may kind of disagree about stuff, but at the end of the day, she's doing the best she can, and I appreciate her showing up to school tours and everything she's trying to do. So I apologize for arguing with you, but we're gonna get through this, just like Jason Benson said. We're gonna be okay as long as we look out for each other and remember that. Thank you.
My turn. I was trying very hard to keep our meeting to a special board meeting with special things tonight. And the comments got us started off in kind of a different direction than what was, the special meeting was set up to do. I feel that at this point, for 10 days, we have a really good motion. I think that gives our board members who might disagree with some of that masking that's listed on there a chance to look at that, a chance to see where our COVID numbers are going, a chance to just consider what kind of a motion is a really good motion to support our teachers, our community, our students. And by getting the data, and if that's still open and other parents send it in, it would be nice to add it to it, but we've got data that shows, where our parents are headed. Yeah, they're pretty close on masking and not masking for their students, but, and we've heard them, and we know that that's different. Last year, we looked at the fact that we had 3 levels: school, home, and hybrid in the middle. We knew we couldn't satisfy all 100% of them. We could either satisfy this 2/3, or we could satisfy the ones over here that wanted full-time and the home ones, that 2/3. It was totally, totally hard to do. Could our students have done more like what they're doing this year? Possibly, but we can't have it both ways. We did what we thought was best for the schools, and the children are back in school this year. They're going to get the in-person instruction that they didn't get last year, and I'm looking for wonderful bounds. I have total confidence in our administration, in our teachers, our paraeducators, our all other staff that are working in the buildings, our nurses, our janitors, our lunch staff, everybody that's contributing and trying to keep our students safe. That's the goal of everybody. And I know that we're going to come out ahead because every person in this community cares so much about every single student and every single one of their colleagues and every single one of the people that's involved in making our school system work. I heard nothing but fantastic comments about this teacher or that para or that person on our tours. Thank you so much for being our principals and for being here and being part of us. Look forward to a wonderful year. Do we need an executive session? Discussion that needs to take place. I'm not thinking that we need one for any reason unless there's any updates that we have on our staffing situations that would be not able to be discussed in open session, right? Everybody got it? You all set? Yep. Okay. The date and time of the next meeting is September 20th at 5:30 p.m. And that was already set in here. So it should be here, I'm assuming. We have done different schools through the year, but at this point, I think with the COVID situation, this is the best space and most open for us. Although, did you say this was going to be a classroom? Will that interfere with the classroom?
No, because the board has their meetings in the evening and classes are dismissed at 3.
Okay. All right, thank you. Thank you, all of you. And if anybody is interested in attending the high school community dinner, it's open to the community, so they're doing a spaghetti dinner tonight. So what time are we closing the meeting? Close the meeting at 6. Oh, we're adjourned at 6:11.